Yo, what up, y'all? It's your boy Rob coming back at you once again with another live stream. So, before we get started, you already know what to do. If you're not subscribed to the channel, make sure you hit the bell icon twice. Smash the like button, share this video out to all of your followers, and let's get into it. All right. So, what we're going to do today is we are going to talk about the new C19 variant. I don't know if you guys have heard about it, but it's called BA.2. All right. And in addition to that, there's some other things that are brewing as well. We got a couple hybrid versions of BA.2. We have some shutdowns and lockdowns going on. And what I find the most interesting is that here in the United States, what it seems like is that we're about to open things back up. Now, mind you, we're about to open things back up when the BA.2 variant has places elsewhere in the world shut down. So that's kind of crazy. A lot of times in the United States, we tend to do things backwards, and this is yet again another example of that. Shouts out to Vovo 2 Love in the building. What up with it, Vovo? Good to see you as always. All right. So let's actually get into this. All right. So another thing also, once I get done with this stream, I have two more streams that I plan on doing. I haven't put the premiere windows up, and they'll probably be pretty quick streams like those streams were the other day. But I'll be doing those streams on Blacklight Revelations 1. All right. So let's actually get into it. All right. So what we have here is an article from let's see, where is this from? WBAL TV 11. All right. And in this article, we're talking about China's new COVID-19 lockdown. All right. And with this COVID-19 lockdown, what is being assumed is that this is going to cause a lot of problems with the global supply chain. All right. And why would we be surprised about that? China is a huge supplier of goods and services to the entire world. So let's check it out. All right. China's new COVID-19 lockdowns are just the latest threat to the global economy. So the first question that you probably should be asking initially is, well, why in the hell is China locked down? Russia's war in Ukraine is roiling the global economy as policymakers race to get high inflation under control. But China's response to its worst outbreak of COVID-19 in 2 years is a reminder that the conflict isn't the only risk to recovery. What's happening? The world's second largest economy is pushing ahead with its zero COVID strategy, even as many other governments decide it's time to learn to live with the virus. Now, that's interesting, right? Because I don't think that we're really learning to live with the virus. We got Law in the building. What up with it, Law? Good to see you as always. All right. And we got Emmanuel Carey in the building. What's good with it, Emmanuel? Good to see you as always. Hope everything is doing good with you, gentlemen. All right. We're going to get into this good C19 talk. All right. And then, like I said, after this video, I'm going to go live on Blacklight Revelations 1. All right. So make sure that you guys have your alert set. Make sure you guys, are subscribed over there, which I'm pretty sure both of you guys are. And let's get it. So real quick, while you guys are over here and active, let's just ask the question. Have you guys heard anything about the new C19 variant BA.2? If you have, type in a 1. If you have not, type in a 2. We've already talked about it over here, but we're going to brush up on it a little bit because now they're going to be talking about it a lot more in the mainstream media because it's causing some problems that's not really being discussed. Shenzhen, an important tech hub, has entered a week-long lockdown after the city recorded 66 positive cases on Saturday. All businesses, except those deemed essential, have paused operation or have implemented working from home. Shanghai, China's largest business center, has also imposed stringent measures following a spike in the cases, closing schools, a movie theater, and restricting travel into the city. Who gets it? Who gets hit? Foxconn, one of Apple's biggest suppliers, has suspended its operations in Shenzhen, where it has 2 major campuses. It said on Monday that the date factory work will resume will be advised by the local government. So you already know what that means. Nothing is going to go down or go back to normal until the big Chinese government says that it's okay. You know what I'm saying? So that's not a good thing. That's probably going to cause some problems. What kind of economic problems do you guys think that this is probably going to cause? Definitely supply chain issues. When you see supply chain issues start to occur, what ends up happening with prices? That's the $1,000,000 question. The Taiwanese company said it had shifted production to other sites to minimize the potential impact from the disruption, but it didn't specify which locations would take on extra work. Uncertainty around Foxconn's production is one sign of how China's response to the jump in coronavirus infections will ripple around the world. The country recorded 2,125 local cases on Sunday across 58 cities. Woo, that's a lot. Damn, that's a lot. Look at this. China's response to the jump in coronavirus infections will ripple around the world. The country recorded 2,125 local cases on Sunday across 58 cities. That's a lot. That's a lot. And I'll tell you what, if the United States, which it probably will, starts to get an outbreak like that, man, it's going to be bad news. It's going to be bad news. We're going to be right back into a lockdown situation. Lockdowns in China could further drive up container shipping costs, which remain extremely high, and scramble global supply chains that are still trying to sort through pandemic-related delays. See? If there is a case found in the Yantian port, then there could be a port suspension for at least 2 weeks, economists at ING told clients on Monday. That will affect exports and imports of electronic parts and goods. That could make inflation even worse. Spending inside China, an important engine of the country's growth, could also be affected by a new wave of COVID-19 restrictions. This is certainly the worst virus situation in China since the Wuhan lockdown and threatens the growth outlook as the domestic consumption will take another hit. Commerce Bank economists Hao Zhao and Bernd Weidensteiner said on Monday. Remember, China's growth target of about 5.5% this year was already its lowest in 3 decades. The country's economy expanded 8.1% in 2021, but the pace of growth dropped sharply in the final months of the year. War has brought the world to the brink of a food crisis. Now, remember, how many weeks later is it? We talked about this, 2, 3, 4 weeks ago? How long ago was it that we talked about the food crisis? So this food crisis is old news to us, but it's going to be affected by these new issues that C19 is causing. Seven Torre Holster says the world is careening towards a food crisis that could affect millions of people. Record high natural gas prices have forced the company he runs, fertilizer producer Yana International, to curtail its production of ammonia and urea in Europe to 45% of capacity. Now, do you guys remember we talked about this? We talked about this a while ago, and what we had said was that the fertilizer price is going to increase like crazy. You guys remember that? If you guys remember us talking about the fertilizer price increasing, type in a 1. All right. If not, make sure that you guys are subscribed to Oil and Gold Railroad, and we will definitely be talking about that later on in the week. All right. With less of these two essential agricultural ingredients, he expects knock-on effects for the global food supply. It's not whether we are going to have a food crisis, it's how large that crisis will be, Holster told me. Now, in the comments section, right? Because what I like to do is provide you guys information, and not just provide you guys information, but provide you guys information with solutions. My question for you that I have is, how do you plan to deal with a food crisis? Clearly, that's something that we're going to be dealing with. Since it's something that we're going to be dealing with, then we need to have solutions so that when it hits, we are ready and ahead of it. So my question for everybody that's in here is, how do we deal with the food crisis? How can we prepare now so that it doesn't hit us to where it's irrecoverable? That's the question. More than 2 weeks after Russia invaded Ukraine, the prices of key agricultural products produced in the region have skyrocketed. The biggest problem is wheat, a pantry sample. Supplies from Russia and Ukraine, which together account for almost 30% of global wheat trade, are now at risk. Global wheat prices hit an all-time high last week. Now, here's my thing. When we talked about this when the war first started, we talked about uh all the commodities, right? And when we were looking, we saw that all the commodities were raising in price. So we already know about this. So again, we know what products are going to increase in price. I'm going to ask you guys this in the comments. What products are going to increase in price? What products do you guys think will be affected by the supply chain issues? Now, here's the real question, the $1,000,000 question. How do we fix it? How do we position ourselves to where this is not something that's going to be a major and ongoing problem for us? That's the question. Leave me some suggestions in the comments. There's more. Another major problem is access to fertilizer. Again, so now we have fertilizer again appearing. Okay. There's more. Another major problem is access to fertilizer. Essential for farmers to hit their production targets for crops. It's never been more expensive as exports from Russia grind to a halt. Output in Europe has also plunged thanks to the surging price of natural gas, an essential ingredient in nitrogen-based fertilizers like urea. Now, why is that price surging? Why is that price so expensive? You guys know the answer to this. Why is this stuff so expensive? Julaw says every time you buy, get a little bit more than you need. Absolutely. Absolutely. And then do what with it? We need the right kind of seed for each season. Find locally sourced food. Have you looked into grind solar minimum that's ongoing? No, I haven't heard about that, bro, but I will definitely check it out. I'll definitely check it out. The situation is ringing alarm bells for global food experts. This is going to be a big problem, guys. I got a question for you. Would stockpiling canned goods be a bad idea, or would that be a good idea? What do you think? Agriculture ministers from the G7 countries met Friday to discuss the looming fallout. Any further increase in food price levels and volatility in international markets could threaten food security and nutrition at a global scale, especially among the most vulnerable living environments of low food security, they said in a statement after the meeting. Russia and Ukraine serve as the breadbasket for the countries in the Middle East and North Africa that depend on imports. The United States and Europe will feel the pain too, since the run-up in prices for important agricultural goods will affect businesses that produce foods in every market. So what's that going to do? What effect is that going to have on the economy, guys? That's my question. What effect is that going to have on the economy? Uber's fuel surcharge could just be the beginning. And I think it is. We're going to see a lot more issues like this. Everyone is feeling the pain at the pump, even Uber. The ride-sharing service has announced that it's rolling out a fuel surcharge to help its drivers offset the burden of higher gas prices for at least the next 2 months. CNN's business Ramesha Maruf reports. Starting Wednesday, users will pay an extra 45 to 55 per trip and an additional 35 cents to 45 cents for Uber Eats, depending on the location. Uber said all the money from surcharges will go to drivers. Now, what do you guys think? You already know that that's not going to happen. They're not going to give all that money to the drivers. They need to stop it. They're not going to give all that money to the drivers. They're going to pocket a lot of that money. We know that prices have been going up across the economy, so we've done our best to help drivers and couriers without placing too much additional burden on customers, said Liza Winship, head of driver operations for the US and Canada. Uber said switching to electric vehicles will be the best way to avoid skyrocketing gas prices in the long term. Now, what do you guys think about that? Is that a good idea or a bad idea? I don't think that's a bad idea. I don't think that's a bad idea at all. I don't think that that's a bad idea at all. The only problem is, does anybody know the prices of the electric cars? Are they expensive? How is the maintenance? Are they easy to get repaired? I don't know too much about electric cars. So that's something that you guys will have to educate your boy about. So let me know what you guys think. What up with it, DJ Elmo? My man DJ Elmo is in the building. Good to see you as always, bro. I hope everything is well for you. So another thing that I'm going to be doing, you guys, I got 3 live streams pre-planned. All right. I got 3 of them. The first 2 are going to be on Blacklight Revelations 1. Actually, I might just do the other one on Blacklight Revelations 2. I was thinking about putting it on Blacklight Revelations news, reviews, and reactions because it's crime. But I think I might actually just put it on Blacklight Revelations 1. So make sure that you guys have the alerts set. Matter of fact, I'm gonna ask you guys, where would you guys like me to just do all 3 of them on Blacklight Revelations 1? If you guys want me to do all 3 of them on Blacklight Revelations 1, type in a 1. If you want me to put it on Blacklight Revelations news, reviews, and reactions, the one that's about crime, type in a 2. Let me know. It's giving up $4,000 annually to drivers who use electric cars and has partnered with Hertz to make as many as 50,000 Teslas available for drivers to rent by 2023. So that's interesting. They must be really planning on this gas shortage and these prices to be a part of the long-term landscape, because they're planning this thing out to 2023. In the meantime, though, soaring fuel costs are likely to bite, and Uber won't be alone in deciding it needs to pass some of the expense along to its customers. On the radar, passengers could also start to see surcharges on flights, since fuel accounts for between 20% and 30% of airline operating costs. All right. So that's that as far as what China's new COVID-19 lockdown could possibly cause as far as its effects on the global economy. All right. Now, here's my question. Is what this article saying, is that what you all expected? If it's what you expected, then type in a 1. If it's not what you expected, then type in a 2. Okay, so you guys want me to keep it all on Blacklight Revelations 1? Okay, I'll do that. The only problem is that they just be on some weird shit, man. As far as YouTube goes, they be on some really weird shit. All right. So check this out. This is an article from the New York Times, I believe. What is this? Yeah, New York Times. A new wave of COVID-19 is coming. What's the name of this new wave of COVID-19, guys? Type in the name in the comment section of the new wave. And here's how to prepare. So what we're going to do is we're going to prepare. We're going to talk about some ways to be prepared for this new wave of COVID-19. Before I get started reading, what is it that you think that we could do in order to be prepared? There's some specific things that we can do. What are those things? If you guys know what those things are, or if you guys have some suggestions, please type them into the comments. All right. Taking these 7 steps now can lower your risk and minimize the disruption to your family's life. Now, what do you guys think these 7 steps are going to be? That's the question. We all know what one of them is. We already know that one of them is going to be the jab, right? And if you guys can, please make sure you guys smash the like button. If you're not subscribed to the channel, make sure you hit the bell icon twice And also, please share the video out. Okay. And oh, you know what? Once we get to about 10 people in the room, I'm going to ask about the survey. So just hold your thoughts. And once we get about 10 people in here, we will then ask about the notifications. All right. What up with it, Carla? Good to see you. Hopefully everything is all well. The next wave of COVID-19 is coming, and in some parts of the United States, it's already here. Are you ready? The culprit this time is BA.2. All right, so this is what we're dealing with. We're dealing with the new COVID variant called BA.2. It's a subvariant of the highly infectious Omicron variant. Nobody knows for sure how much havoc it will cause, but BA.2 has already led to a surge of cases in Europe and is now the dominant version of the coronavirus in the United States and around the world. Did you guys know that? It's now the dominant version of the coronavirus here in the United States and around the world. My man Ashanti Black is in the building. Good to see you, bro. What up with you? Hopefully all is well. Researchers are tracking an uptick in cases in the United States, and they've detected a rise in the viral particles recovered from nearly 150 wastewater surveillance sites. Now, isn't this interesting? I got a question. Those of you guys who follow this channel routinely, we've been talking about the wastewater issue for a while, right? Now, hey, what's up with it, Val? Good to see you. Now, my question, guys, is what's the significance of these wastewater tests? What's the significance of them? That's what I want to know. Let your boy know what the significance of these wastewater tests is in the comment section. Because people can shed the coronavirus even if they never develop symptoms. Pieces of the virus collected in wastewater can serve as advanced warning several days before an official case count rise, says Bronwyn McInnes, who directs pathogen genomic surveillance at the Broad Institute in Cambridge, Massachusetts over the past 2 weeks. Dr. McInnes's group has seen a rapid increase in levels of BA.2 subvariant in the Northeast. See, we talked about BA.2 last week. If you guys check the community post, make sure you guys, when you get a chance, make sure you guys check the community posts and smash the like button on that post where I posted the video of us talking about BA.2 last week. Now, there's a lot of news coming out in the press about BA.2. They haven't said up until now, they haven't really been talking about it. But this thing has been ramping up and ramping up and ramping up and ramping up. Not saying too much. So you got to ask yourself the question, why? Why is the media treating this like this? I don't think we're looking at a crazy lockdown scenario in this part of the world with BA.2, which is interesting because in Asia, they're actually having a lockdown. In Asia, they're actually having a lockdown. So again, that's something that's kind of interesting. It's kind of counterintuitive. But what you got to ask yourself is, well, why is it being treated this way? It's kind of being treated weird here in the United States. Why? It's not really being treated the way that you would think it should be being treated. But we can't be sure that we won't have another curveball from this virus in the future. American health officials have said they are hopeful that BA.2 won't cause another mass surge, in part because so many people were infected by the original Omicron wave this winter and most likely have some natural or vaccine immunity to protect them against severe illness and hospitalization. Now, I got a question for you guys. What is one of the things that is what is one of the things that's unique about this specific variant? This variant has some very interesting properties and some very unique properties. What are some of those properties? And I agree, DJ Elmo, American corporation can't shut down the economy. Facts. They were first to lock down in 2019 and 2020. That's a big fact, Emmanuel. And yeah, shouts out to everybody that's in the room. I appreciate you guys being here. But other variables could turn the BA.2 wave into a more damaging surge. One concern is that less than 70% of Americans over 65 have had a first booster shot, leaving a large group vulnerable, said Dr. Eric Topol, a professor of molecular medicine at Scripps Research in La Jolla, California. And for many people who got their booster shots in the fall, immune protection may be waning. Unvaccinated people who are counting on natural immunity from a previous infection by a different variant should know that BA.2 can easily sidestep those fading immune defenses. And there's the question of whether the pandemic fatigue will prevent some people from taking reasonable precautions like wearing masks and social distancing when COVID numbers start to rise in their area. We know how to manage it, said Dr. Robert Watcher, a professor and chair of the medicine department at the University of California, San Francisco. But the big caveat will be that there are lots of parts of the country that will not go back into careful mode. It's wishful thinking to believe we're going to stay in a situation as good as we are now. Now, that's interesting, guys. What is being implied here? Because in my opinion, this paragraph right here is key. And not only is this paragraph key, but I think this is one of the things that's going to cause us major problems. If you guys agree with me, type in a 1. If you disagree, type in a 2. See, this is what I keep talking about when I ask the question, well, everybody else is locking down and we're opening up. What is the implication of that? And that's what I want to ask you guys. What is the implication of that? What is that going to do? What is that going to cause? That's the question. While the virus is unpredictable, there are clear ways to protect yourself. Now, this is what you need to know, all right? Because I'm telling you, one of the things that's different about the information that I try to provide the people who are kind enough to spend their time listening to my content is not just complaints, not just fear mongering, but solutions. People should never present problems to you without a proposal for a solution. Do you guys agree with that or do you disagree? That's how I feel about everything. If someone comes to you with a problem, if someone comes to you with a complaint, if they're not coming with a solution or a proposed solution, always be weary about it. If you're coming to the table and you're bringing attention to a problem, you better have a solution or you better have a suggestion of where to start at. So in this article here, we're going to talk about some ways to protect ourselves. Now, we already know what one of the things that they're going to say is. What is something that they're going to say as far as a way to protect yourself? Give me some suggestions of what you guys think they're going to say already. The plans you make now can lower your risk of exposure, minimize the disruption to the lives of your family and friends, and help you assure you have access to treatments if you or someone you know becomes seriously ill. This is where you want to listen, guys, so get your pen and pad. Here's what you can do to prepare, all right? This is what you can do to prepare. Pay attention to COVID indicators in your community. Now, this is what I need you guys to do. List in the comment section some ways that you can pay attention to COVID indicators in your community. What can you do? How can you be up to date about what's going on with COVID-19 in your community? That's important, and you guys should know the ways to do that. Don't wait for public health officials to issue warnings. Keep an eye on COVID-19 statistics for your county or region. An easy way to do this is to check the color-coded map from the Center for Disease Control and Prevention that shows community levels of COVID-19 around the country. So that's one way. make sure that you check the color-coded map from the Center for Disease Control. That'll tell you how many infections are in your area, which that's some pretty important information because it may determine whether you feel safe enough or feel froggy enough to go outside or not. Right. And I got to agree with Val and Carla. They're saying jab and get reboosted. Those are definitely some things that they'll probably say. We can more than likely, almost with certainty, assume that these are going to be mentioned. The map is mostly a welcoming green right now, which means that there are relatively low rates of new cases and hospital admissions, but there is a growing number of yellow spots showing medium risk in Texas, the Northeast, and other areas, and orange-colored hotspots are cropping up in Montana, the Dakotas, and other states, indicating high rates of community spread. As the map shifts to yellow and eventually orange in your area, it's time to take extra precautions, including donning a mask in public spaces and rethinking large indoor gatherings where you don't know the vaccination status of others. If you want even earlier warning of COVID trends, you can bookmark the CDC's wastewater data tracker map. Now, here's my question. These two maps that they're talking about, do you guys have access to these maps? If you guys have access to these maps, type in a 1. If you don't have access to these maps, type in a 2. If you guys do not have access to these maps, I will send you the links in the comment section so that you can use them if that's something that you'd be interested in doing. Okay? Val says the state of New Jersey has a website that shows the infections in the area. Yeah, that's good, Val. I think that Ohio might have that too. And Val says, I've never stopped wearing my mask. I'm not mad at that. I'm not mad at that. I'm not mad at that at all. Another useful indicator is your community's positive test rate. Experts advise taking more precautions as you see positive test rates to start rising above 5%. The Johns Hopkins Coronavirus Resource Center shows daily U.S. and state-by-state testing trends. All right. So the next thing that they advise is to have high-quality masks on hand. High-quality masks on hand. How many of you guys got high-quality masks? Uh-oh. Carla acting like Putin launched one of those nuclear weapons, y'all. She says get your hazmat suit out. Masks, gloves, goggles, the little blue slippers, one of those the sterile shower cap things that they wear. Get all that shit. Put it on. Spray yourself down with Lysol. We ain't playing out here. What did Trump say? Drink bleach. Do a system flush. Again, let's just put this out there. Just kidding on that drink bleach part. Gosh, bet you that article don't say one word about vitamin C or diet. I bet you it don't. But that's a good point to bring up. Now, this is what I need you guys to tell me. List good sources of vitamin C. Also, list if you think those sources of vitamin C are going to be the same prices that they usually are. Even if you're not wearing a mask now, check your mask supply and make sure you have plenty of high quality medical style masks on hand. A limited number of free N95 respirator masks are available at pharmacies and community centers. Now, here's my question to everybody that's watching. Have you guys gotten your free masks? If you got your free masks from the government, type in a 1. If you have not gotten your free masks, type in a 2. I'd advise you to get some. N95s are pretty expensive. You may as well get that shit for free if you can. You may as well get it for free. All right, so we got 10 people in here, ladies and gentlemen. My question for you guys is, did you get a notification? If you did get a notification, type in a 1. If you did not get a notification, type in a 2, okay? Enter your zip code on the CDC's mask locator. And do you guys have access to the mask locator? to find a participating distributor near you. If you want to buy additional masks, use our guide to find a reliable supply of N95, K95s, or KF95 masks and avoid counterfeits. Now, I'll tell you what else something that might not be a bad idea to do is something else that might not be a bad idea to do is to check the expiration date on the masks. Oh yeah, absolutely. Absolutely. That's what you call population levelers. So Carla and Ashanti Black did not get notification, but everybody else got a notification. Okay. I'm gonna add every time I go live, I'm gonna ask that just to make sure, just so we have it on record, so everybody knows. You know what I'm saying? Now, also before we get started, is everybody in here subscribed to Blacklight Revelations 4 and Blacklight Revelations news, reviews, and reactions? Because I think that I'm gonna go live on both of those, but later on tonight. These other live streams that I'm gonna do, the first one I'm going to do is about Mayor Eric Adams. The second one that I'm going to do is about Elon Musk. And the third one that I'm going to do is a follow-up about the California shooting. Okay. And you guys said that I should put all of those on Blacklight Revelations 1. I was going to put the one about the California shooting on Blacklight Revelations news, reviews, and reactions because it's crime. But if you guys want it on Blacklight Revelations 1, I will put it over there. I'll put it over there. Yeah, they do look at us like we're the crazy ones. I bought KN95 masks. I got packs of 50. I ain't mad at it. I'm not mad at that. Since many communities have lifted mask mandates, when and how often you use a mask is probably going to be up to you. Now, with this new variant, do you think that it's wise to not have a mask mandate? That's my question. How do you guys feel about not having a mask mandate? What do you guys think? The masks need to go on when you start seeing case numbers going back up, says Lindsay Marr, professor of civil and environmental engineering at Virginia Tech and one of the world's leading experts on viral transmissions. Dr. Marr says she knows people are tired of masks, but wearing one is only a minor inconvenience and is a proven way to lower your risk. I'm not into fear mongering, but there's still so much we don't know about long COVID that I don't want to get COVID and I don't want anyone else to get it either. Now, here's the question. How many people know what long COVID is? We've talked about this multiple times. If you do not know what long COVID is, please make sure that you binge watch all of the videos on this channel. All right. Just as you're driving or something, hit a playlist, put it in. Anytime any video comes up on the home screen, make sure you guys click on it, watch it all the way through to the end. All right. Hit the links at the end of the video. Okay. I don't want anyone else to get it either. And the more people who wear masks as cases start to rise, the sooner the next wave will be over. Home order COVID tests sooner rather than later. All right. Now, I got a question for you guys. Do you all know how to COVID test? If you know how to COVID test, type in a 1. If you do not know how to COVID test, type in a 2. Those are very important. And if I'm not mistaken, I think those home COVID tests are free. But don't quote me. Okay? Don't quote me. Each U.S. household is eligible for 2 sets of 4 home COVID tests free from the government. If you haven't ordered them yet, get them now before the weather turns warm. Tests can be damaged by heat, and you don't want yours sitting for hours in a mail truck on a hot day. Now, that's interesting. So it looks like, yeah, you can get some free COVID-19 tests It looks like that is an option. What up with it, Rain King? Good to see you, bro. The tests can be damaged by heat. You don't want yours sitting for hours in a mail truck on a hot day. Now is better than a month from now, especially for people in hot locations, said Dr. Michael Mina, Chief Science Officer for eMed, a company that verifies at-home test results. Just take advantage of the program, get them, put them in your cupboard for when you need them. People with insurance can also be reimbursed for 8 free tests a month. If you look, so that's interesting. People with insurance, you guys can be reimbursed for 8 free tests a month. Now, I got a question. How many of you guys in here use a flexible spending account? Have you ever used a flexible spending account? If you've used a flexible spending account, type in a 1. I actually used a flexible spending account. Those are actually pretty nice. Flexible spending accounts are not bad at all. If you develop respiratory symptoms, have a fever, or just feel unusually fatigued, use a test on the first day of the symptoms. If the symptoms persist and you still test negative at home a few days later, you may want to get lab-based PCR tests to be sure. Okay? If you can afford it, test when you think that you have allergies. Test when you think that you have a cold, said Kelly Hills, a bioethicist and risk expert and co-founder of the counseling firm Rogue Bioethics. This is one of the things I think people need to get in the habit of setting aside money for, because tests provide important data for making decisions. So this is what Carla and Val were saying that they would say. And look at that. We predicted it. We were right. Everybody give Carla and Val a round of applause. They were right. We got Jehovah's Panther in the building. What up with it, Jehovah's Panther? Good to see you as always, bro. Yeah, I'm sleepy too. I don't know if you guys hear. I'm trying to not yawn, but I'm yawning. You know what I'm saying? I'm trying to not yawn, but I'm yawning. So, federal regulators have authorized a second booster shot for everyone 50 and older. The agency also authorized a second booster for people 12 and older with certain immune deficiencies. Now, this is interesting. I didn't know anything about this. What immune deficiencies do you think that they're restricting this for? That's interesting. While scientists are still debating the value of another booster, most say that people 65 and older and the immune compromised are likely to benefit. If you haven't gotten your first booster shot, experts agree you should get one now. If you've recently had COVID, you most likely have as much natural protection as you'd get from a booster shot, at least for a while. Now, this is interesting. They're talking about natural protection. They haven't talked about natural protection very much. Why do you guys think that is? Why haven't they talked about natural protection very much? And I also got a question. Would you guys like me to try to do more streams from this channel, even if there's not a lot of information? Would you guys just like me to try to keep you guys updated with some shorter streams? You know, even if the streams are like a half hour or something. Yeah, the article says experts. I know, right? Like, who's an actual expert at COVID-19 besides the C19 channel on YouTube? You know what I'm saying? Besides this channel, who's an actual expert at C19? YouTube is funny. YouTube is hilarious. They're annoying, I'll tell you that much. The protective antibodies from a vaccine or an infection tend to wane in 4 to 5 months. A well-timed booster shot tells the body to bump up its antibody defenses and help other parts of the immune system, like B and T cells, become better at remembering how to fight the virus, said Theodora Hatzianu, a virologist at Rockefeller University in New York City. Get a pulse oximeter. Now that's interesting. How many people know what a pulse oximeter is? If you guys know what a pulse oximeter is and what it does, type in a 1 and then give me the definition in the comments. Oh, South Jersey. Okay. Yeah. You know what? It's kind of nice actually in Ohio, shockingly. Allegedly, it's supposed to be pretty nice all day today, so we'll take it. You know what I'm saying? Once I get done with these streams, I'm gonna probably make a couple phone calls and be kicking it. Me and TD Hip Hop guys, we have a live stream that you guys are not gonna want to miss, and it's coming up on Friday at 2:00 p.m. So put that in the back of you guys' heads. You guys are not going to want to miss this. Okay. So what's a pulse oximeter, guys? Have you guys ever used one? That's the question. And what is it used for? A pulse oximeter is a small device that clips on your finger and measures your blood oxygen levels. What does that mean? It measures your blood oxygen levels. What does that mean, guys? What are they talking about when they talk about your blood oxygen level? What up with it, Tia? To you, good to see you. Is the AI acting crazy again? What is it? Nightbot? I don't see Nightbot over here in the comments. I'm trying to. I apologize if I'm missing comments. I'm trying to switch back and forth from screen to screen. Did I miss Nightbot acting weird, doing some strange stuff? Yeah, Law is right. Do you guys agree with Law? It measures blood oxygen. If you don't agree with Law, you should. He's right. How much air you're getting? Kinda. That's a little vague. Not bad, but just a little bit vague. Not so much air because there's more than just oxygen in air. This specifically measures the percentage saturation of oxygen is in your blood. Now, what's the ideal amount that you want to have in your blood? Who knows? What's the ideal amount of oxygen that you want to have in your blood? And also, just so you guys know, the links for Facebook are in the description box. So if you guys are ever interested in posting an article or you see some good information, all you got to do is just hit those links in the description box, go over to the Facebook group, post an article in there, tag your boy. Also, the community page, you'll get a notification when we go live. So there's lots of benefits for being subscribed to the Facebook page. All right. When levels drop to 92% or lower, patients should see a doctor. Low oxygen can be a sign of COVID pneumonia, and it can raise your risk for serious complications from COVID-19. The devices can be less reliable for people with darker skin, so pay attention to downward trend as well as the number. All right. And in my experience, there's never been an issue with people with darker skin. In my opinion, I don't feel that that's true. I haven't seen that. And I haven't come across that in my practice, and I've dealt with all different kinds of people. You know what I'm saying? So, just so y'all know. And if you guys can, please make sure you guys smash that like button. Also, make sure that you guys share the video out to all of your social media. You guys are doing a wonderful job of keeping the chat active. That is great. I definitely appreciate it. All right. A study from South Africa found that the risk of dying from COVID-19 was about 50% lower among patients who had been instructed to monitor their oxygen saturation at home. You can find the devices for about $30 in pharmacies and online. Researchers say the pulse oximetry reading on your Apple Watch is probably less reliable than the fingertip device. And that could be true. Now, I got a question for you guys. Have you guys ever heard of the disease called COPD? We got my man FU2 in the building. What up with it, FU2? If you guys have heard of the disease called COPD, type in a 1. If you have never heard of COPD, type in a 2. Okay. What is COPD? Somebody tell me what COPD is. And why is it important? Why would I bring it up? The next thing that they're telling you to do is make a plan for antiviral drug treatment. It's always our fault. Of course, you already know it's our fault. You know how we do. Please read. Oh, hold on real quick, DJ Omo. Let me go back up and look. Okay, here we go. Very important. Oximeters measure oxygen, but in the UK, oximeters have been exposed for misdiagnosing black folks' oxygen level. Medical equipment designed for white biology. Yeah, and one thing that they don't tell people, which is absolutely true, is that our biologies are very different. Okay. Even though they say, well, we're all the same, that's not true. That's not quite true. Okay. It's just not. Maybe one of these days we'll go into it. Like I said, on this channel now, you guys are going to want to make sure that you follow this channel and had a bell icon hit, because we're going to be talking about all-inclusive healthcare issues, not just C19. We're going to be talking about everything: the heart, the eyes, the ears, the digestive tract, reproduction, GU, GI, endocrine, diabetes, diet, exercise, health. Why not? What do you guys think? Does that sound good or no? 2 oral antiviral therapies are available to treat COVID-19 in the United States, though they require a doctor's prescription and are authorized only for people who may be at high risk of severe disease. One is called Paxlovid, developed by Pfizer, is taken as 3 pills twice a day for 5 days. It is available for high-risk patients 12 and older. All right, so this is what we're talking about here. Let me see, hold on. Paxlovid. Have you guys ever heard of Paxlovid? If you guys have heard of Paxlovid, type in a 1. If you've never heard of it, then type in a 2. Okay. And this is a drug by Pfizer. The second drug is called Molnupiravir. Now, we just talked about Molnupiravir in the last video that we did. Molnupiravir was developed by Merck in partnership with Ridgeback Biotherapeutics. Now, we all know who Merck is. What's the other famous drug that Merck came up with? Everybody knows the other famous drug that Merck came up with. I'll give you a hint. They were calling it horse tranquilizer. They were calling it horse tranquilizer. What's the name of the drug that they were calling horse tranquilizer? You guys know. What's the name of it? Joe Rogan was using it. It was something else he was talking about one of the times when he wasn't talking about black people. And chronic bronchitis is a kind of COPD. COPD is chronic obstructive pulmonary disease. Asthma is a type of COPD. Bronchitis is a type of COPD. What happens when you have COPD? What happens when you have COPD is you can have a higher normal blood carbon dioxide than a high normal oxygenation. So if you have COPD, then that means that your resting pulse ox at normal levels may be lower than other people. That's important, because if you oxygenate somebody that has COPD a little bit too much, then that oxygen can become toxic. It's one of the reasons why you got to pay attention. Hydrochloroquine, that's right, Ashanti Black, no doubt. No, actually, hydrochloroquine is a antiviral drug, I believe, for COVID-19. It's not the one by Merck that I was thinking about. Val's got it down here. Ivermectin. This is it. Ivermectin. She got it. Shouts out to Val. She got it. Ivermectin. She is correct. Okay. And also, don't forget, guys, once we get done with this stream here, about 15 minutes after we end this stream here, we will be going live on Blacklight Revelations 1. All right. We're going to be talking about your boy, Mayor Eric Adams. Now, everybody, I know you guys like Eric Adams. I know you guys are fans. So I'm going to try not to go in on him too hard for you guys' sake. Oh, man. It's taking his 4 pills twice a day for 5 days and is available for high-risk adults 18 and over. For the pills to be most effective, you need to start taking them within 5 days of the start of your symptoms. So it's important to have a plan for getting a prescription and knowing which pharmacy can fill it, said Kuldip Patel, the Senior Associate Chief Pharmacy Officer at Duke University's hospital in North Carolina. You can use the COVID-19 therapeutics locator to track local supply of the drugs and check with your doctor to make sure that you can receive the medication if you fall ill. All right. You can also look up quality pharmacy-based clinics near you, as well as community health centers and long-term care facilities that have an authorized medical provider so you can get tested and, if positive, receive antiviral medication on the spot. People who are immune compromised should also talk to their doctor about Evusheld, a drug from AstraZeneca that can be given by injection to provide an additional layer of protection on top of vaccines. Have backup plans for social events and travel. Now, this is interesting. My question for you guys is, how does this work? That's my question, guys. How does that work? Does anybody know? If you guys know how that works, then what you want to do is make sure that you share your secret. Okay? Make sure that you guys are sharing secrets. If you have plans for a graduation party, wedding, or other large event, it's a good idea to have an outdoor backup plan if your community's case numbers spike. If you're planning to travel, do a little advanced research into clinics and pharmacies at your destination so you know whether you can get antiviral drugs if you catch COVID-19 on your trip. Make sure you have extra funds or plenty of room on your credit card in case you need to extend your trip to recover from COVID. You still need proof of a negative COVID test for international travel. Okay. So you still need that. You still need that. Okay. Health experts said planning for the next wave of COVID shouldn't disrupt your life or prompt you to cancel travel plans or time with your friends and family. So this is important. Again, I find this interesting. They're softening the language. They're definitely softening the language. Bartham Encyclopedia of Herbal Medicine book recommends sea moss and the herb eclampamine for removing mucus from the lungs. That probably would help a great deal for people with COPD. Even though with COPD, one of the signs is not that you excessively develop mucus, but it's always good because of the diet that we have and a lot of the food that we eat, for whatever reason, people tend to be developing a lot of mucus all the time as it is anyway, which is kind of sad. It's kind of crazy. In fact, being prepared for the unexpected will allow you to keep living your life as normally as possible. A lot of people feel it's a terrible inconvenience and they are sick of it. And I understand that, said Dr. Topol of Scripps Research. We've had a timeout and it's been good, but people should be ready to gear up if the need be. All right. So that's cool. That's the end of that, right? So here's my question for you guys. Do you guys need access to this article so you can use some of the resources from it? If you guys want this article so that you can use some of the resources from it, type in a 1. If you don't need it and you feel like you're pretty okay on your own, then type in a 2. Okay? Because what I could do is I'll post it on Patreon, all right? And I'll also post it I'll post the link into the chat. Okay? Because I want you guys to have access to this kind of information. And that's another thing. I don't just post videos on Patreon. I know you guys really like a lot of the articles and stuff like that that I use to for the content. So a lot of times I post those articles right inside of the Patreon. Okay. And sometimes there's articles in the Patreon that I haven't done videos on. Um, when it comes to when it comes to utilizing uh the AdSense revenue and stuff like that, and super chats and membership money that I get from YouTube, one of the things that I do with it is I get articles to subscriptions, or I get access to subscriptions. I'll order a newspaper, or a newspaper, or a subscription to some media, and I use a lot of that to compile information for a lot of the content that I do. So some of those things I can view, and some of the things I can't. Most of the time, stuff that I can view, the paid stuff, that's what I do content on, because everybody doesn't have access to that. But what I can do is I can just arbitrarily post some of these articles into the Patreon, and you guys can read the articles, especially stuff that I don't do videos on. Because why would you guys read the article after I did a video on it? Unless you're trying to reference a certain part or get a screenshot, then I get it. But you know what I'm saying? So I can do that. And the link to Patreon is in the chat, and it's only $5. And one thing that's good about it is it brings everything together. And also I post everything in there. So you'll get another notification anytime I go live, and you'll be able to watch the live streams through there. So I'm trying to expand. That's one of the things that I'm doing. You know what I'm saying? So here's the article. I saw a couple 2s. Okay. All right. So here it is right here. I'm about to post it in here right now. All right. It depends on if they have mucus. And they do that by listening to the sounds that your chest makes when it's percussed. I think the assessment technique for that is called what is that called? Damn, I can't think of it. I cannot think of the name of it. I had to look it up. You said the Nightbot is wilding out. You know what's crazy? I can't see the Nightbot. It's not showing up. It somehow is hidden itself. Is it blocking people and stuff? Because that's the last thing we need. That's the last thing we need, is the Nightbot acting stupid and blocking. Like we don't need that. Nightbot, you're gonna have to calm down. So this right here, this is an article from WESH2. Central Florida sees spike in COVID-19 cases, but they say that it's manageable. So let's check this out.
Twisted Tea is a refreshing hard iced tea made with real brewed tea. Keep it twisted.
It's an unwelcome change. For the first time in 2022, the number of new COVID cases in Florida is once again increasing.
Yeah, this is coming after weeks of numbers going down. They started to creep back up in the middle of last month. You can see the numbers here. Experts tell our Dave McDaniel the latest variant seems to be the driving force.
Well, I think it's time for us to loosen up according to where we are today. The question is where will we be in 2 months?
Local health leaders remain on watch. Statewide, there's low transmission of COVID, but in places like long-term care facilities where people are most vulnerable, there are some increases in cases, even though much smaller than what we've been through.
For the vaccinated and boosted, I think we can take our masks off pretty comfortably unless you have a bad immune system.
We've gone from COVID-19 to Delta to Omicron to the BA.2 variant of Omicron. The one circulating right now, the easiest to catch.
The BA.2 variant is much more communicable. It's much easier to transmit to somebody else.
That's important. That's important. And that's what's being downplayed. So here's my question. To me, that's one of the most important pieces of information. You guys agree? That right there is one of the most important pieces of information. So with that piece of information, what does that tell you about how to keep yourself safe? Give me the answer to that question.
Statewide, there's low transmission of COVID, but in places like long-term care facilities where people are most vulnerable, there are some increases in cases, even though much smaller than what we've been through.
For the vaccinated and boosted, I think we can take our masks off pretty comfortably unless you have a bad immune system.
We've gone from COVID-19.
Ashanti Black, you said that you were hidden in some of the last streams. Hold on real quick. I'm about to check and see what happened, because I noticed like there's some weird stuff going on. Hold on real quick. Let me just see something. Let me see something. Let me just look and see here. Let's see. Those last streams that you were talking about, those were on Blacklight Revelations 1. Holy shit, what the fuck? All these motherfuckers got hidden? Emmanuel got hidden? Ricky Jones got hidden? Ashanti Black got hidden? The fuck? Who hid these motherfuckers? Okay. All right. I just removed everybody from hidden and shit. What? That's crazy. If that ever happens, if you guys ever, because that happened to Carla one time before, I think, if I'm not mistaken. If that ever happens again, please let your boy know. I don't know how that would have happened. I don't know why that would have happened either. I'm sorry that happened. I was wondering, I'm like, man, and I haven't seen Ricky Jones around in a minute. I'm like, what happened to Ricky Jones? No wonder. I know it wasn't me that hit him. Hold on. Let me now you guys got me curious. Let me just hold on real quick. Hidden users. Okay. Yeah, that's crazy, man. I'm sorry about that, y'all. That's annoying. And you have no way of knowing it. That's one of the reasons why I tell everybody. It's so important. Make sure you guys are subscribed to my other social media, and also make sure that you're subscribed to all the backup channels, because I have no way of knowing that somebody got removed. So if you guys see Ricky Jones in the YouTube streets, can you guys please tell him that I did not block him? I think he'll probably be in. He goes to TD a lot. Let him know that I didn't block him. I have, because I don't block anybody. So again, that's irritating. All right, I'm glad you said something about that, Ashanti.
To Delta to Omicron to the BA.2 variant of Omicron. The one circulating right now, the easiest to catch.
The BA.2 variant is much more communicable. It's much easier to transmit to somebody else than any of our other variants.
So far, at least the newest variant seems less severe, and the vaccinated have the least to worry about with the latest variants. And in addition to vaccine,
we have treatment today. We have 3 great treatments for people that get COVID. So how much are we afraid if you're vaccinated and boosted? Not very much.
Dr. Husty gets regular briefings in his role as EMS medical director. Europe, especially England, is spiking with the new variant, leading to this cautionary tale, even with low COVID numbers right now.
Do not pretend like this is totally gone. It's not. We just don't know what trajectory it's going to be on.
See, did you guys hear what it said about Europe? Now, if Europe is going crazy like that and jumping with COVID, then pay attention. Okay, so if you guys ever see anybody hidden that's a regular in here, please unhide them if you guys are mods, okay? Like, if you guys see Ashanti, or if you guys see Ricky or anybody else that's not supposed to be hidden. Sometimes I try to converse in the comments, but I don't see anyone's comments but my own. I'm telling you guys, that's YouTube doing that shit. That's why I always ask everybody, like, please try to, like, just excessively comment, just so people can see that the comment thread is working, because sometimes there'll be like 30 people in there and like nothing is going on, and it's like, what the hell? And I'll tell you, I don't buy bots. So it's not that there's people in there watching, it's just the comments ain't showing up for whatever reason.
Leading to this cautionary tale, even with low COVID numbers right now.
Do not pretend like this is totally gone. It's not. We just don't know what trajectory it's going to be on next.
In Seminole County, Dave McDaniel, West 2 News.
All right, so that's that. So what do you guys think about that? Central Florida sees a small spike in COVID-19 cases, but it's manageable, experts say. Now, here's my question. Is it manageable? Do we know that for a fact? Yeah, it's definitely YouTube. YouTube be on some bullshit. That's one of the reasons why my channel never grows. UK adds 9 more COVID symptoms to official list as it struggles with record caseload. But yet we're debating what we should do with this new variant. 9 more COVID symptoms to official list as it struggles with record caseload. What does that tell you? If it's saying that it's struggling with the record caseload? Yeah, that's a good question. Who's behind the spike in heart attacks? That's a great question. We will definitely go into that. We will definitely go into that. Tia says she thinks that it's manageable. Yeah, I've seen this. If you guys have seen this happen, type in a 1. That's why I started using Restream, where it can post the comments up on the screen, because as I'm looking at the comments on my screen, it'll show different comments than what's in the comment section. So that's one of the reasons why I do that. Experts fret about the XE hybrid Omicron variant. Uh-oh. What is the XE hybrid Omicron variant? Have you guys heard about that? If you guys have heard about the XE Omicron variant, type in a 1. If you've never heard about it, then type in a 2. See, we got some more Omicron variants here. Experts fret about the XE Omicron variant that WHO says is likely to be 10% more infectious than BA.2. This is how fast this thing is moving, guys. What up with it, Tammy? Good to see you. This is how fast this thing is moving. We haven't even gotten through BA.2 yet. We haven't even gotten through BA.2 yet, and here they go. They got another one. Look at that. The official list of symptoms of COVID-19 has been explained in the UK, where cases are currently running at the highest levels since the start of the pandemic. The National Health Service added 9 new symptoms to the list of just 3, including sore throat, fatigue, and headache, as The Guardian reported. So we'll check this out. Okay, we'll definitely check out what The Guardian's got to say. So what are the symptoms? These are important. Sore throat, fatigue, and headache. Okay. Those are the symptoms. Now they added some more on there. About 1 in 13 people in the UK, or 4.9 million people, were estimated to have COVID in the week through March 26th, up from 4.3 million the previous week, the Associated Press reported. So I have a question. Does it seem to you guys like this new variant of COVID-19 is going to be a problem, or no? That's what I'm curious about. Tammy says that she's at work listening. Who else is at work listening? If you guys are at work listening, show some love. Shouts out to the people that listen at work. If you're a work listener, type in a 1. The latest surge is driven by the more transmissible Omicron variant BA.2, which is the dominant variant across the UK. So BA.2, it seems like it's taken over dominance. Because remember, it also said BA.2 is now the dominant variant here in the United States. Hospitalization and death rates are rising again. Uh-oh. So remember, they're not making any effort to put anything back into place. All we're doing is just ramping things down here. You on second shift, FU2? That's what's up. I listen to YouTube at work too. Although the number of people dying with COVID-19 is still relatively low compared with earlier this year. However, the latest estimates suggest that the steep climb in new infections since late February, when British Prime Minister Boris Johnson scrapped all remaining coronavirus restrictions in England, has continued well into March. Okay. So let's see what this lady is saying here.
All of our vaccination teams, including our fantastic GP teams and pharmacies, will have been thinking really carefully about how to make the experience of getting the vaccine as comfortable as possible for our children. This will include reasonable adjustments, fast-track lanes, longer appointment times, and in some cases, even some superheroes coming along to lend a hand.
So that helped with about nothing, right? I mean, what did that help with? Nothing. The figures on the same day government ended free rapid COVID-19 tests for most people in England under Johnson's living with COVID plan. People who do not have health conditions that make them more vulnerable to the virus need to pay for tests to find out if they are infected. Look at this. Biden says U.S. turning corner on COVID, but experts are worried that BA.2 is pushing cases higher in 15 states. So, again, like, you got to ask, you kind of got to ask, what are we going to do about this? Because it's looking like it's moving. It's looking like it's moving. Appreciate you, FU2. I definitely appreciate you, bro. Thank you very much. I hope you guys all enjoy it. Trying to make it better. That's what I constantly do. Try to strive for that continuous improvement for you guys. James Naismith, a biology professor at the University of Oxford, said, except for those who are completely shielded or not susceptible to the virus, most people in the country would likely be infected with the BA.2 variant by the summer. So, I mean, they really have some high expectations of transmissibility for this new variant that's coming out here. Yeah, and that's facts, DJ Elmo. True. Tia, you don't trust the tests? Do you think they give a lot of false positives? That's my question. Do you guys think that the tests give a lot of false positives or no? This is literally living with the virus by being infected with it, he told AP. The news bodes badly for the U.S., where cases are still falling nationally, but are picking up in more than a dozen states thanks to BA.2. You see that? They're picking up in the United States. The United States has lagged in cases in the UK and Europe by a few weeks since the start of the pandemic. So do you guys see that? Cases in a dozen states are picking up. Cases in a dozen states are picking up, guys. The U.S. is averaging 27,088 cases a day, according to a New York Times tracker, down 9% from 2 weeks ago. But the cases are rising in states in the Northeast and in the South. The country is averaging 16,122 hospitalizations per day, down 27% from 2 weeks ago. The daily death toll has fallen below 700 to 649, but is still undesirably a high number. There are growing concerns about a more contagious hybrid Omicron subvariant that combines genetic material from BA.2 and the original BA.1 strains. The recumbent variant has been dubbed XE. All right. So now we're not even through. We haven't even started having to deal with BA.2, and we're already worried about some new hybrid variant. So my question for you guys is, do you guys see how rapidly this thing is changing? I mean, this thing is changing extremely rapidly. Like, it's just, in Fantasy, he's had a lot of stuff about the about the natural immunity. The only problem is that we're not allowed to talk about it on YouTube. If we talk about it, it'll affect our channel, which is nonsense. As you guys can see, they're already messing with my channel. DJ Elmo and U-Law, I tell you, we used to have like the same amount of people watching this as we do on Black Light Revelations 1. And Black Light Revelations 1 is already messed up because they never exposed that channel to new viewers. But we used to have like 20 to 25 people in here watching all the time. And then like now, like people don't even get the notification that this channel is live. It's crazy. It doesn't make any sense, but it is what it is. The World Health Organization said last week that it is estimated to be 10% more infectious than BA.2. Now, these findings here need further confirmation, but this is what they're saying. So if it's 10% more infectious, I mean, it seems like a lot of people are probably going to be getting infected. That's probably what's going to end up happening. XE belongs to the Omicron variant until significant differences in transmission and disease characteristics, including severity, may be reported, the agency said in a weekly update. Daniel Craig's return to Broadway in a new version of Macbeth has temporarily halted after the actor contracted COVID-19, the AP reported. Wednesday's matinee and evening performances were canceled when the James Bond actor tested positive. So again, COVID-19 is hitting them celebrities, man. I swear, sometimes I wonder. You guys remember when I had done the video of the Senate hearing where Ron Paul and Dr. Fauci were debating and they double struck my channel? I think only DJ Elmo and U-Law were around back then. We had a whole different crew back then. I'm telling you, there used to be like 25 people in here. Look at it now. Just out of the clear blue sky, it just dropped to 5. You know what I'm saying? If you guys are still in here, type in a 1. If you're not still in here, type in a 2. I'm about to prove this to y'all. I want y'all to pay attention to this. Everybody that's in here, drop a 1. I guarantee you, if everybody drops 1s, more than 5 people will show up. So we already got 2, 3, 4, 5. And DJ Elmo, Tia, and Ashanti Black haven't dropped any yet. So this is what I'm saying. Like, you guys see this, right? So you see what the number is saying. The number is saying 6, and we got 1, 2, 3, 4, 5, 6, 7 people right here. This is what I'm saying. So that's proof right there. 1, 2, 3, 4, 5, 6, 7, 8. I mean, that it's saying 6. So that's proof right there. I mean, we basically just proved that this is nonsense. And remember, when y'all had first started dropping 1s, it was saying it was only 5 people in here. Like, I'm like, I know it's not 5 people in here because everybody's actively chatting. So now it's up to 7. Look at that. And it's still not right because it's saying 7. 1, 2, 3, 4, 5, 6, 7, 8. People dropped 1s. Now it's saying 8. So this is what I'm saying. You can't trust YouTube. And see, Val says on hers it says 5. You know what I'm saying? So you cannot trust YouTube. You know what I'm saying? And the only way to keep it accurate is you guys got to be smashing that like button. Y'all got to be chatting all the time so it registers. Y'all got to be hitting those buttons at the end of the screen, or else it's just going to make this shit up. And the thing that's crazy is it does this to deter people from the video. You know what I'm saying? Like, it'll be like 10 people in here, and it'll show that there's 0 people in here. You know what I mean? And see, mine says 10. Jehovah's Panther is in here. So this is what I'm saying. Now it says 10. But did you see how it dropped to 5 and nobody came out and left? Like, this is what I'm saying, man. YouTube is on some bullshit. Blocking people. Like Ricky Jones was somebody who came to my videos all the time and then he just stopped. No idea that he was hidden or how he got hidden. No idea. This shit is wild, man. But anyway, in a tweet late Saturday night, the show said all performances were canceled through Thursday due to detection of a limited number of positive COVID test results within the company. Craig stars in a revival of William Shakespeare's tragedy, Ruth Negga, making her Broadway debut with playing Lady Macbeth. A 60-year-old German man from the eastern city of Magdeburg allegedly had himself vaccinated against C19 dozens of times in Germany in order to sell forged vaccination cards with real vaccine batch numbers to people not wanting to get vaccinated themselves. The AP reported separately. Oh, wow, that's crazy. We'll talk about that too. We'll talk about all that stuff soon. Yours says 9. Mine says 12 now. If you guys haven't, make sure you smash that like button. Now it says 13. See, that's it. I'm telling you, we used to have like 20 people in here all the time. You know what I'm saying? Like, and then like motherfuckers just disappeared and shit. And I'm telling you, it's people that be in my other videos. So I know it's people that will be watching. You know what I'm saying? Like, it's like Bronze and Hob and like Catsy and other people that be in there, Pretty and Ink. You know what I mean? Like, people that been around for a long ass time. It like they're there too. So like the thing is that I know this shit be on some bullshit. Izzy. You know what I mean? It's YouTube. I already know it's YouTube. I see this is what I put that in my community post. I see people who don't even go live or don't drop videos daily. Their channel will just grow by like 10 subscribers a day. Rain King is up in here. Rain King been around forever. You know what I'm saying? So like, it's certain people that I know are here. Yeah, let me see if I can find it real quick, Jehovah's Panther. Give me a second. And that shit is irritating. It's like, come on, man. Like, when there's nobody in the chat, or if the video is registering that there's nobody in the chat, that shit deters people from wanting to watch. Because people are like, oh, this video is not active. People will say this video is not active. There's nothing going on in here. Nobody's watching. So, you know, I'm just going to leave. You know what I'm saying? When in reality, there's actually people in there. So just be aware of that. There's going to always be somebody in the chat, whether they watch or not. Like I said, More Math, the dude named More Math just popped up out of the clear blue sky. And I haven't seen him in ages. in ages. So there's people that watch and just don't even type anything. So I know there's more people than what they say there is. You know what I'm saying? And they just play that little game. Let's see what we got here. So, okay, I got a question for you guys before we move on. Did you guys hear about Elon Musk? What do you guys think about it? Which video is it? Jehovah Panther. Oh, here it is. I see it. It's the one with Kim Iverson on it. I see it. Hold on real quick. I'm about to get it right now.
The group requesting the documents sued, and a judge ordered the FDA to make them available by the end of this year. Well, each round of documents is to be delivered on the first of each month. So this past April 1st, no joke, over 11,000 pages were released. Between these documents and another document released on March 24th to the group, a group called...
All right, guys, I'm going to scroll this back a little bit. All right, let's check this out.
Kim, what's on your radar?
Well, another round of Pfizer documents have dropped. This is part of the 340,000 some odd pages the FDA and Pfizer wanted to release over the course of several decades. But instead, the group requesting the documents sued, and a judge ordered the FDA to make them available by the end of this year. Well, each round of documents is to be delivered on the first of each month. So this past April 1st, no joke, over 11,000 pages were released. Between these documents and another document released on March 24th to the group, a group called Public Health and Medical Professionals for Transparency, we've learned some bombshells. The first bombshell in the document is that natural immunity works and Pfizer knows it. The clinical trial data showed those with previous infection of COVID had no difference in outcome than those vaccinated. In the limited trial, none of the vaccinated nor those with previous infection resulted in severe disease defined by either the FDA or the CDC. They were broken up into two different groups. The FDA and the CDC define severe COVID slightly differently. The CDC roughly defines it as anyone needing hospitalization, whereas the FDA defines it as anyone needing supplemental oxygen. Either way, there were 0 cases of severe COVID in the natural immunity group, whether they were vaccinated or not. And their own data also showed that natural immunity was statistically identical to the vaccine against infection. That's what their data showed. Yet, rather than say people with natural immunity don't seem to need the vaccine, which is what they've been saying in Europe, for example, Pfizer instead spun their conclusion and said, quote, final efficacy results show that the vaccine provided protection against COVID-19 in participants with or without evidence of prior infection with SARS-CoV-2. Another revelation from the documents was that adverse reactions were more frequent and more severe in younger groups. The document reads, quote, reactogenicity and adverse events were generally milder and less frequent in participants in the older group compared with younger group, and overall tended to increase with increasing vaccine dose. Older is defined as 55 and older, and the study itself was for 16 and above. So the side effects were more frequent and more severe in people under 55, even though we know the younger you are, the less likely you're to experience severe COVID. According to the Lancet, 16-year-olds have a 99.993% chance of surviving COVID. A 30-year-old is at 99.943%. At 50, their survivability is 99.572%. Drop below 99%. A document procured during the dump was a consent form for a children's clinical trial of the Pfizer vaccine. The form is from December 15th, 2021, so only 15 weeks ago. And it interestingly states some facts that have been labeled by the mainstream media as being misinformation. The consent form lists several possible side effects, including myocarditis, which many of us know about. But the document says the rate of occurrence is 10 in 100,000 people, and they don't specify age or gender. So that's much higher than previously reported rates of 1 in 50,000 people. Even then, we know the bulk of those cases are in younger males. So when controlling for age and gender, the risk significantly increases. The consent form also states, quote, the effects of the COVID-19 vaccine on sperm, a pregnancy, a fetus, or a nursing child are not known. And this is something that has caused a lot of younger women and parents of teen girls hesitation, which they were demonized over. And people have worried that there could be long-term side effects affecting fertility. Despite these scientists admitting in this consent form that they simply do not know, it has been espoused as fact that the vaccines don't have any adverse effects on reproduction whatsoever. But the fact is, we simply don't know. Another idea condemned as a conspiracy theory is what's called an ADE response, antibody-dependent reaction. This is when a vaccine ends up triggering a worse illness than what the person would normally experience. And doctors like Robert Malone, who have been sounding the alarm of this as a possible reaction to mRNA vaccines, have been demonized and smeared, yet the consent form clearly states, quote, although not seen to date, it cannot yet be ruled out that the study vaccine could make a later COVID-19 illness more severe. So if it were really not even something to be concerned about, the form wouldn't even bring it up. Yet here it is saying they can't rule it out yet. One other interesting admission from the document dump is this statement, quote, clinical laboratory evaluations showed a transient decrease in lymphocytes that was observed in all age and dose groups after dose 1, which resolved within approximately 1 week. So in plain English, this means white blood cell counts dropped in that 1 week after the first dose of the vaccine. So this is leaving a person with a weakened immune system for a week after getting the first dose of the vaccine. So there's a lot of things that we could speculate from this, like, is this why we saw a sudden spike?
If you guys haven't smashed that like button, please make sure you smash the like button. Also, if you haven't shared the video out, please make sure that you do. That definitely helps.
In cases in countries that began mass vaccination campaigns, with people weakened immune systems, where they're all catching the virus a lot more vulnerable to catching the virus suddenly for that little period of time. Also, since people weren't even considered partially vaccinated until a week or so after getting the dose, did this skew the infection rate? If you got a bunch of immunocompromised people for that week running around and then catching the virus, and then they're considered unvaccinated, is that fair? These are questions that kind of leads us towards. But in the least, it seems like this would be good information for people to know about. When you want to know that your immune system is perhaps compromised for a week, you'd maybe be more careful. We're at least learning about it now, even though we didn't know about it before, but now we're learning about it because of the data the FDA and Pfizer didn't want released. We're finally seeing it. So interesting stuff coming out in these document dumps. And I think obviously at this point, a lot of this is just hindsight, right? Although there are still a lot of implications, there's a lot of places still doing mandates. A lot of the colleges are still doing mandates. And now we see from these documents that from the trial, Pfizer even said there's more adverse reactions and they're more severe the younger you are and the more you dose. And we just don't have long-term data yet. And they admit that in these documents, yet I think I don't know if it was, I feel like when I go back and look at all the statements that Pfizer made, I don't feel like they said much different than actually what's in these papers. It's just that they didn't correct when, let's say, Fauci or FDA spokespeople or, Rochelle Walensky, or when they kind of said things that were maybe a bit counter to this, they didn't come out and say,
what up with it,
actually not
Dondre?
accurate. So I'm not sure if it, where the blame then goes. And also, I think we need to look forward and say, maybe we should be reevaluating a lot of the decisions, especially when it comes to younger people.
The pharmaceutical industry is not used to transparency. Like it's not their preferred approach. And
the pharmacy is actually supposed to not necessarily the pharmaceutical industry, but the pharmacy is supposed to provide transparency all throughout the healthcare system. There's supposed to be transparency. So for this, again, like this guy here is just the more I listen to The Hill and the more I listen to his commentaries, a lot of times he just seems like one of those people that just says things and doesn't know what it is that he's talking about. That's not true. That may be how things have become, but that is not at all the way that anything is supposed to be with healthcare. There's always supposed to be transparency. In healthcare, there's what's called a non-disclosure, or I'm sorry, not a non-disclosure, but an informed consent. And one of the basis of that is to make sure that people who are receiving care know exactly what's being done to them, and if they're able to authorize it or not. So this is interesting. And if you guys haven't smashed the like button, please make sure you guys smash that like button.
You know, and I think particularly in a pandemic where public health becomes almost as
What
important
up with it, Jay?
as the way that you're specifically treating it, because you need the public to be invested in and to trust what they're being told by public health officials and by.
Yep, that's him. Anytime we go over an article from The Hill, or anytime we do a commentary on one of these little videos here that they have, anytime you guys see this guy say or do anything that's completely stupid, we always got to bring it up. We got to bring it up. Yeah, that's his dumb ass. Yeah, that's him. So I saw Jay, you were in Afro Elite's video last night. Shout out to Afro Elite. He did a really good video. I think you were in there too. Good video last night. You know what I'm saying? Talking about the Black Panthers. If you guys haven't watched it, you guys should check it out.
Everybody involved, transparency becomes that much more important. So they really shouldn't be. I really wish they had not fought this. And you know, the more pressure on them to release all of the evidence of efficacy, all the evidence of side effects, everything. Just get it out there and let people study it.
And given that, you know, a combination of things that you can certainly still contract the virus and spread it if you're vaccinated. Maybe you're less likely to do so, but vaccination is not standing in the way of, or is any other mitigation effort standing in the way of a wave coming through and everybody getting it, because we've seen that happen at least twice now. So given that, and given that the severity for younger people of the disease, it's not that bad, that there's very low death rate among young children, among the under 18, otherwise healthy people in the younger age categories, also not in that much trouble. Given those realities, I don't see how you can justify the requirement for vaccination in many of the settings where they're most likely to be required, schools, university campuses, as you mentioned. It seems, and given then also, you know, what you're raising about side effects, and that even if they're mild side effects, even if you're, you know, kind of sick for a day or something, and then that's it, that still might end up being, for this age category, that might end up being worse than the disease. Or maybe it's not, but why shouldn't it be your choice, or, you know, something you talk to a doctor about? It has to be required. It seems so hard to justify that for the groups of people most likely to have the mandates in place. Yes, beyond 50, if you have an underlying health condition, absolutely, I think the calculus totally shifts. But that's different when we're talking about the people most likely to have vaccine mandates.
Yeah, I mean, the older people, we know the older you get, the more severe COVID is for you. In fact, if you're 100 years old, so I was looking at the chart of survivability, and if you're 100 years old, you're still, believe it or not, more likely to survive COVID, but not by much. It's 57% survivability once you hit 100. But it starts to drop below 99 at 60. Well, these people are retired. You know,
what up with it, Carlton? Good to see you, bro.
You're looking at the vast majority of them not even being working. So you're right; they're not even subject to mandates. But what this latest data dump really showed us, especially with them admitting they don't know the long-term side effects with fertility.
So now that we got 17 people in here, I want to do the survey again. If you guys got a notification, type in a 1. If you did not get a notification, type in a 2. Okay. Again, if you guys got a notification, type in a 1. And if you didn't get a notification, type in a 2.
Or sperm or anything like that. They don't know the long term. They even said in the previous document dump from March, there was a document that showed they don't know the long term side effects of even myocarditis once it subsides. So they said, yeah, most of the cases, the patient subsided, the symptoms were gone, but we don't know.
Did you do a religious exemption? Did you do a religious exemption, DeAndre?
Long term, what that means. They state that. So to have younger people, and then these documents to say, yeah, the younger people and the more doses, it seems that they have more adverse events. Why would we then have young people?
What are they saying about it?
To do this?
Yeah.
It just doesn't make sense when you go through all these documents. And I think this proves that. And I think for a lot of those parents that have been fighting mandates, I think this document dump will be very consequential to them in that battle. I think in the legal battle moving forward. So I think that's where these documents come in handy is in the, also, their admittance to certain side effects like myocarditis. We know that now. My big question is, are they paying the medical bills for these patients who ended up with myocarditis? Or is that just, sorry, that's your risk. You took it, you knew that there was that risk. Did you? I don't know. So
they'll probably try to get out of paying it if they can. I don't know if you guys know about the scandal that Bayer company had during the 1980s. Did you guys hear about that? But the company Bayer, who is the manufacturer of the famous aspirin, they had a situation in the 1980s when they shipped out a bunch of products that were positive for HIV. They were blood products for hemophilia. And what ended up happening was a lot of people in the UK, a lot of people in South America, a lot of people in Australia, and a lot of people in China ended up getting infected. They ended up acquiring HIV as a result of faulty practices. And see, Carlton is saying the same thing that DJ Elmo said, and I agree. What about a mandate on eating healthy, exercising, and resting? I don't think that we'll ever see that mandate come from the government. I don't think that that's going to happen. But what I do think is that we have the power to make those mandations on our own, right? And follow them. That's what I think. And I think that that's probably the best and only way anything similar will happen. If you guys agree with that, type in a 1. If you disagree, type in a 2.
So why are they not then forking over the cash for those medical bills? I'm not certain if they are or they aren't, but I tend to think they're not, because I know that they were released from any sort of liability. But so I think that's what these documents are going to mean moving forward, is maybe they will be used in the mandate, legal defense, and parents trying to prevent their children from being vaccinated, possibly.
Well, thank you.
All right, guys. So, yeah, shouts out to Jehovah Panther. Everybody drop some emojis for Jehovah Panther for telling us about that. And if you guys want me to, I can actually link this video here for you guys to watch on Patreon, okay? Because this is a really good video, and it'll help it stay organized. Jehovah's Panther is on my Patreon page, and he'll definitely tell you that there's plenty of content there. All right, so it's not like there's not stuff for people to watch or for people to read, because there's plenty of stuff on there. So what I want to show you guys real quick is this. Yeah, you never heard about that with Bayer? Yeah, that actually happened, man. That absolutely happened. How many of you guys heard about that bear fiasco? If you guys heard about that bear fiasco, type in a 1. If you didn't, type in a 2. Yeah, that absolutely happened. Bunch of people got HIV. Yeah, the Patreon is got a membership. It's the $5 thing. But what I can also do is I can put it on the Facebook group as well. So if you guys are on Facebook and you go to Facebook and you find the Black Light Revelation C19 group, not only do the live streams go live there, you can comment and stuff like that in it too. So if you're not able to get Patreon, remember what I always say about Patreon. It definitely helps, but it's not a requirement. You know what I'm saying? Wow. Yeah, man. I might actually have to do a video about that. I actually did a video about it. Let me real quick before we actually we can actually talk about, you know what, the best documentary for that was actually on Russia Today, and they've removed Russia Today. So let me see. Russia Today had a really good documentary about that. Okay, so check this out. There's a video. Hold on. Ah, okay. Check this out right here. Check this out right here. Hold on real quick. This is a good little summary here. Let me see. All right, so just so you guys know, yeah, we up to 16. We up to 16. Shouts out to the room. Make sure you guys smash that like button. And also share the video out. That definitely helps. Check this out. Now, this is just like a little I don't know, this is just like a little summary of this, right? But this is something that everybody should know about. In my opinion, there's certain situations, certain things that people should really be aware of, and this right here is one of them. Let's see.
Next month marks 32 years since the Centers for Disease Control first acknowledged that medicine meant to treat the disease hemophilia was actually infecting people with the HIV virus. This outbreak among hemophiliacs in the early 80s infected between 6,000 and 10,000 people, despite the fact that pharmaceutical companies, chiefly pharma giant Bayer, knew the plasma they were using to create their blood clotting product was tainted. So here to discuss this harrowing anniversary and what the case tells us about corporate accountability today, I'm joined now by attorney, host of Ring of Fire Radio, Mike Papantonio. Thanks so much, Mike, for coming on.
Abby, good to be here.
So for those that don't know about this case, can you quickly explain how Bayer was able to sell HIV-contaminated blood products to the public and how early Bayer knew about the problem?
Well, they knew about it within a year and a half after the product was on the market. They knew there was some contamination in the blood that was causing some very serious illness. And they said, well, gee, we didn't know that was HIV. We didn't know it was AIDS. Well, they did. All they had to do was do basic testing even at that point. But what's worse is once they knew that whatever it was in the blood was killing people, they said, you know what, we're going to take it off the market here. And then they immediately started selling in places like South America and Asia, where people actually went to prison. You had actually people working for the companies overseas going to prison. Nobody went to prison here. They killed thousands of people. They knowingly killed thousands of people because, you know why? Because they said, we have all of this stuff in stock. We have to do something with it. So what are we going to do? We're going to sell it to a place where nobody knows about it. And so you'd have children that would infect the entire family with the AIDS virus. And interestingly enough, again, nobody went to prison in the United States.
Wow, I guess just a bunch of market casualties there, huh? I mean, wow, what an unbelievable criminal act here. Why were there no criminal charges against top executives at the company in this own country?
Well, at that point, they had started developing a lobby. I actually handled part of that case, and they sent so much lobby money to Washington, D.C., that the Department of Justice didn't do what they should have done. But we're seeing this with designer drug products that are killing and crippling consumers, Abby, all over the United States. Typically, they make it to the market with the same steps. First, the industry capitalizes on direct-to-consumer advertising laws that are only good in the United States and Australia, where they can tell a consumer, hey, use our drug, use our factor 8 drug, and it'll solve your problem with clotting. And then that's direct-to-consumer advertising that you don't see anywhere else. So they create the need for the market. They even go as far as creating diseases sometimes. They create diagnosable diseases that we've never even heard of before. Turn on your TV on most days and you'll see drugs being hustled for everything ranging from restless feet to restless eyes, for God's sakes.
Sound familiar? Now, if that sounds familiar, you know, type in a 1 and drop some names of what he could possibly be talking about. Now, mind you, you guys can tell, you can look at this and tell, this is an old video. All right, this is an old video. And as I'm looking in the comments, a lot of you guys seem shocked. This actually happened. This is real. With a trusted pharmaceutical large company like Bayer, the baby aspirin people.
Feeling old, you take testosterone gel. Feeling underperformer, you take Viagra. Feeling sad, mad, or overly glad, you pop a pink pill or two and you're good as new. The first step for any accomplished drug hustler is to create the need for this endless market with an advertising blitz. And that's the new designer the new designer drug approach. That's only the first step. And the first step, too, of course, is to hustle the FDA and use the FDA insiders that you're paying money to indirectly to go to work.
What a mess. I mean, this is just so insane, though, because, I mean, knowingly infecting people and then sending it to developing countries that you know is tainted medication here that could cause HIV. I mean, it's just a whole nother level of insanity here, Mike. I mean, you've called it a rogue operation. I wanted you to talk first about why you called it that, and then also how the notion of corporate personhood plays into these type of cases.
Yeah, in many countries, when a company does this type of thing, they lose their right to be a corporate person. They get the death penalty, Abby. They're told you can't do business in here. You're a repeat offender. Bayer has more repeat offending fines and criminal sanctions of any company I've ever worked against, and I've been doing this for 30 years. They're all equally bad in one way or another. But the point is, until you say to a company, you do this once,
yeah, that's facts.
maybe look
Nothing
the other
has
way.
changed.
You do it twice, you're going to lose your license to do business. Until we do that, you're always going to have that criminal culture. They're a rogue company in many ways, but now it's kind of the regular way
I'm
of
sure,
doing
Val.
business in the United
I'm not
States.
surprised one bit.
It's called big risk. and quick profits. MBAs come out of school and they're moving through. They take a position on the board of a company like Bayer. They know they're only going to be there for a few years, so they break every rule they can. They push the law to the max, and they make as much money as they can in bonuses, and then they leave the mess for the next CEO to come along. It's the new way.
See, and now, if you guys recall, if you guys have not watched the stream from a couple days ago, please make sure you guys go and watch that stream on this channel, okay? Make sure you guys watch the most recent stream, not this one, but the one that I did before that. We're actually talking about a situation where a doctor was fired from the ER as a result of having issues with the staffing that the hospital was providing them. You know what I'm saying? What up with the THPP? What's good with you, bro? So again, like what this attorney is saying here, all of this stuff is true. It's all true.
Way of doing business. It is the new model for pharmaceutical companies nowadays. Used to be a CEO would stay with the company, Abby, for 25, 30 years. Not anymore. They're
That's
young
what's up,
kids,
bro. I appreciate
MBAs
you.
moving through, trying to grab up as much profit as they can. The decisions they make most of the time are criminal. And I don't overstate that. They are criminal decisions, and we look the other way and say it's okay for you to do that. It's just the way we're doing business in the United States.
But it's just insane, Mike. And I don't think a lot of people realize that there's only direct-to-consumer advertising with pharmaceutical companies here in New Zealand. So it really is this kind of, in terms of big pharma, I mean, this is a very, very unique problem here in America. I mean, a study just came out by author Brandon Garrett that examined 303 non-prosecution, deferred prosecution deals between corporations and the government between 2001 and 2014, and found that only 34% of the time was an individual charged with a crime. And of those,
Yeah, these companies are wicked as hell. I'm telling you, that's one of the reasons why I do the news reviews. And that's also one of the reasons why I decided to start up the C19 report channel. That's why I'm telling everybody, make sure that you guys binge watch the channel. As videos show up on the home screen, make sure that you watch them. Watch them bad boys all the way through to the end, and then watch the next recommended video. It'll put a window up that suggests a video. Always make sure that you guys hit that video, because I'm telling you, this channel right here has so much information from the start to the end of the pandemic. And so does Blacklight Revelations 1. There's some videos on there that were untouched when they started striking, but that's why I started a new channel, because I kept getting back-to-back strikes when I would simply just go over an article that was published about something crazy that was going on with C19. I didn't want to risk losing my channel. I wish I had known one of them was going to end up getting demonetized anyway, but I started this channel, and then this channel just kind of exploded with growth, and then all of a sudden YouTube just kind of said, nope, not anymore. Same thing with my other channels. You know, YouTube is just like, nope, not anymore. You know what I'm saying?
was only 42% received any jail time. I mean, obviously, this Bayer thing happened long before the corporate personhood thing. I mean, how did our judicial system evolve to treat corporate crime so differently than street crime?
Well, it became a matter of money. There was a time when the pharmaceutical industry, and it was right around the time of this Bayer case we're talking about, that they figured out if we give the same amount of money to Democrats as we do to Republicans, then we've covered ourselves on both ways. For example, Loretta Lynch, the new AG that Obama is trying to push through. Democrats are looking like, oh, this woman's wonderful. Well, she's not wonderful. She's simply a corporate hack, just like the other people that have come before her. But the industry, the drug industry, figured out we have to cover both sides of the aisle. So they started spreading around huge money to Democrats, just like Republicans, and they passed laws that allowed them to do things like direct-to-consumer advertising. They passed laws to make it almost impossible to meet the criminal threshold for a white-collar criminal who's dressed up in an Armani suit. And so they made it so difficult to where these guys running these companies, they don't feel any risk at all.
See that?
They feel no risk at all because they say, yeah, we're a person, but we're a person.
No risk because no consequences, because the fact that it's a corporation buffers the actual people involved from being liable for anything. so the people can do all of this crazy stuff under the guise that it's a corporation, and then they can skirt responsibility. Consequences are the key to everything.
Person that's so big that you can't put us in jail because you
Unbelievable.
can't pinpoint who made the decision.
Unbelievable. Thank goodness for lawyers like you who are taking on these real criminals. We need to end the two-tier justice system. Mike Papantonio, host of Ring of Fire Radio. Thank you so much for coming on.
So yeah, so that's that. All right. I think that was a good way to end this. And if you guys are interested in watching this video again or having some reference information, like I said, I'll be more than happy to post this up on Patreon. I'll be more than happy to post it up on the Facebook group so that you guys are able to watch it. And that's it for now. All right. So I'm probably going to go live on this channel again tomorrow because there's some more information that I want to cover. And I want you guys to be able to check it out. If I don't go live on this channel tomorrow, I'll probably go live on this channel later on tonight. It depends. I kind of got some things to do, but I have those 3 videos that I want to get done on Blacklight Revelations 1. So I'm going to end this video here. All right. I appreciate everybody watching. Please make sure if you haven't smashed the like button, you smash the like button. Please make sure you guys share the video out. Please make sure you guys binge watch all of the content and leave comments on the videos as they come up. All right. And I will see you guys in about 15 minutes to a half hour on Blacklight Revelations 1. And we will get into talking about Eric Adams. Now, before everybody leaves out of here, real quick, I want to know, how many of you guys saw my community post about Eric Adams? I'm curious. If you saw the community post about Eric Adams, type in a 1. If you didn't, type in a 2. Let me know let me know if you guys saw the post about Eric Adams. You guys know what that numbskull is up to? So Fantizzi knows what Eric Adams is up to. No good. Ashanti saw the community post, knows what he's up to. Everybody saw the community post. Carlton saw the community post. Val saw it. Okay. All right, cool. All right, yeah, we're going to get into that. We're going to check out that article from the Miami Herald. All right. We're going to look at the video that they posted on Twitter, and we're going to talk about the implications of that. And then after that, we're going to talk about Elon Musk. And then after that, we're going to talk about that LA shooting. And then later on tonight, I'll leave it up to you guys. You guys want to talk about some science stuff, or do you guys want to do some news reviews and reactions? I got some crazy shit for news reviews and reactions, but I got some crazy shit for science too. So, you know what I'm saying? So let me know. News reviews and reactions, type in a 1. Science, type in a 2. Let me know what you guys want. Let me know what you guys want. I'll try to get them all in, but if I'm not able to, then we're going to go with whatever you guys vote here first. So you guys want science? I know. What's the Nightbot? You remember Queen Destiny that used to come to the videos, Val? Remember the Nightbot used to mess with Queen Destiny and Carla all the time. It would always mess with you, Queen Destiny, and Carla. The Nightbot, man, so stupid. See, Stream Elements bot don't mess with anybody. It just does what it's supposed to. It just, puts the links into the chat and calls it a day. Oops, shit. But man, that thing used to mess with Queen of Destiny bad. Nightbot might want to see you in the street. It said, "Do you want to dance?" So it might actually be trying to get you out into the streets. Who is Nightbot? Is that AI? Yeah, it's AI. It's supposed to be smart. It's supposed to learn, but it clearly doesn't. All it does is just harass people. It just harasses my comment section. It just harasses my comment section. And usually what's fun, it's not funny, but it usually just picks women to harass. Like it never really, and I swear I didn't program it to be like that. I did not program that thing to be like that. You know what I'm saying? It just does it on its own. I didn't tell that thing to do that. But it harasses women all the time. If it finds some nice ladies in the chat and it just starts going in, I'm gonna block you, I'm gonna mess with you, I'm gonna type something smart every time you type something. Like, seriously? Like, chill out, down, boy. You know what I'm saying? That shit's funny. All right, you guys. Give me about 15 minutes to a half hour. I'm gonna get this get everything together. We'll be live on Blacklight Revelations 1 shortly. All right. Appreciate you guys watching. Remember, make sure you guys smash the like button anytime you see the video on the homepage. Always click it, check it out, watch it all the way through to the end. Hit the links at the end, share it, and I will catch you all on the next one. All right. Peace.